In every stage of life, a woman has the opportunity to make important decisions that can maximize her health and prolong her life. At the Washington Women's Center, we have the in-depth knowledge and breadth of experience in all facets of women's health care. We're committed to helping women get started on and to continue on the path to good health by helping them make healthy decisions along the way and by showing the way to achieving balance and wellness. This series of women's health programs is designed to offer women of all stages of life the information they need to live a healthy life.
It's good to see all of you here. My name is Kathy Hesser, and I'm the Women's Center Coordinator. And it's my job to not only bring you classes that are focused on women's health, but also to bring you programs around exercise, around breast cancer. And so I welcome all of you here today. This is a subject that a lot of women always ask me to present, and I'm happy that Dr. Saleh could be here today to present on the topic of urinary frequency. So sorry, gotta run. Yes, I feel that way myself sometimes. And so our main goal with all of our programs here is to give you something that you can learn and actually take away and use. So I'm hoping that we reach that goal today. I'd like to introduce our speaker. Dr. Mark Saleh is a Canadian. When I was first a nurse, I worked with a lot of Canadian orthopedic surgeons. Oh, so I always love our Canadian doctors. He is a diplomat, board certified by the American Board of Urology, and he is with our Washington Township Medical Group, and he's here today again to talk about urinary frequency or overactive bladder treatment and diagnosis and treatment. And then we also have our physical therapist who will be talking for a little bit afterwards on exercises that you can utilize. So again, welcome Dr. Saleh.
Thank you very much. And thank you everyone for coming today. I hope you'll enjoy this. So it looks like I have to stand back here, so I hope you don't find that too impersonal. So we're going to be talking about overactive bladder. Bottom, what that's supposed to say, the main thing is that urgency is the main symptom that you need to define what we call an overactive bladder. And urgency is the sudden, uncontrollable urge to void. It comes with very little warning. Sometimes it's associated with bladder leakage, and sometimes it's not. But if you have sudden urgency when you don't have a full bladder, that's basically the definition of an overactive bladder. You have an overactive bladder. Now, often that also comes with frequency, voiding more than 8 times a day. It comes with nocturia, or getting up at night, and it may or may not be associated with leakage. So if you have urge incontinence, if you have a sudden sense of urgency and you can't hold the bladder and you leak, that's called urge incontinence, and that's what we call a wet version of the overactive bladder. Now, you could have the dry version where you just have the urgency and you're always running to the bathroom, which is not as bad, but still very bothersome for most patients. This is a diagram of the female pelvis. I'm going to come around here. This is the bladder sitting in the pelvis. This is the urethra where the urine comes out from. The vagina is right there, the uterus, and the rectum. And this is the pubic bone. With childbirth and with relaxation of the muscles that help support the bladder, you may have what's called a cystocele, where the bladder falls down through the vagina, and you might see a bulge down here. That often causes what's called stress incontinence, where when you cough or sneeze and the pressure inside the abdomen goes up, it pushes on the bladder and causes the urethra to open up uncontrollably, and then you have a little bit of a squirt of urine. That's a different type of problem. The stress incontinence and the urge incontinence and the overactive bladder sometimes go hand in hand, but they are separate problems that are treated differently. If you have pelvic relaxation and you have stress incontinence, you could do Kegel exercises to help strengthen the muscles of the pelvic floor and to close off the urethra here and to prevent the stress incontinence. If it's more severe, you might need a surgery to lift the bladder up or put a sling underneath the bladder. That's a procedure that we could do in about 15 minutes as an outpatient. That works really well for the leakage. But let's go on with the overactive bladder. Here's a question for the audience. What do you think is a normal bladder capacity? What should a bladder hold? 250 milliliters is about 1 cup. Any guesses?
300, 500.
That's right. Very good. That's the answer. So there are variations, of course. Some people have a small bladder and have about 1 cup or less for capacity, and that's part of their problem. And they might be born that way, or they may have had some sort of condition that affects their bladder. Chronic inflammation, infections, major surgery on the bladder, radiation to the pelvis can all sometimes cause the bladder to become contracted and small, and that can lead to urinary frequency because the bladder just simply can't hold very much. So what is a normal amount of voids per day? What do you consider to be frequency? What would be a normal number of times that you should go to the bathroom? Any ideas?
4 to 6 times.
Yeah, it seems like C is always a good one, isn't it? Or 2. We don't consider somebody to have urinary frequency until they go 8 times a day or more. Now, of course, it's very variable, and if your normal is 2 to 3 times a day and you're going 5 or 6, that's probably too much for you. But on average, 8 times or more is considered urinary frequency. No, it's okay. We can describe it. Basically, we looked at the diagram of the female pelvis in general. This is a close-up of the bladder. So this is the bladder. This is the urethra, where the urine comes out. And these muscles here is the pelvic floor and the external sphincter that helps you control the urination. As the bladder fills up, when it gets to about half of the capacity, so roughly 250 to 300 milliliters, that's when most people get an urge to void. But you should still be able to hold it. When that happens, the bladder gives you a minor contraction that gives your brain the idea that you have to go. You make your way to the bathroom, and contractions, a medication called, or actually a neurotransmitter called acetylcholine is released by the nerves that causes the bladder muscles to contract. And that's what a bladder contraction is, and that's what causes voiding. In an overactive bladder, we think that reflex, that the acetylcholine is being released too much, or that the bladder muscle is too sensitive to that chemical, so that the bladder contracts sooner than it should. Before it gets to capacity, when you only have 100 milliliters, maybe half a cup or less, you get the urge to go. So you go, you only void a small amount, the bladder fills up again to that small volume, and you have to go again, and the cycle continues. And the way to deal with that is to block that transmission, to kind of minimize the nerve action on the muscle. And we'll talk about the medication that does that later. So when do you need to be concerned about an overactive bladder? When is it not just an overactive bladder? If you don't have any other symptoms associated with it, then that's probably all it is. And you can just see your doctor, and they can start you on a medication called an anticholinergic medication. If you have any of these symptoms, then you really probably should see a specialist and should be evaluated further. If there's any blood in the urine, that's never normal. Microscopic blood that the doctor tells you about, or whether you can actually see visible blood, is even worse. You should always be evaluated by a urologist with x-rays, a cystoscopy. Pain or burning is not normal. That might be a sign of a bladder stone or infection. If you have a pelvic mass that the doctor discovers on examination, if you've had radical pelvic surgery for, say, a hysterectomy for cancer, if you've had radiation therapy, all those are indications that it may be not just a run-of-the-mill overactive bladder. Suspected fistula, if you're leaking constantly, and if you've had pelvic surgery, you may have what's called a fistula, which is an abnormal communication between the bladder and the vagina, or to another part of the body, where the urine is leaking from an abnormal opening. And that would require repeat surgery. We won't worry about the men today. They'll have their own talk. So why is this a big deal? What's the burden of an overactive bladder? A very large number of people in the United States have symptoms of overactive bladder that may be undiagnosed or untreated. We think at least 33 million people are involved, and that includes men and women and people of all ages. And the prevalence does increase with age, as you might expect, because of various associated medical conditions. So this just gives you an idea about that first of all, the blue bars are men, the white bars are women, And this is as you increase in age, these are age groups 18 to 24, and up here it's 75 and plus, the prevalence or percentage of people that have it increases as you would expect. Most people that have overactive bladder have what's called the dry overactive bladder, where they can hold the urine long enough to make it to the bathroom. About a third of them, 37%, have the wet version. That's urgency with urge incontinence, where they get the sudden urge with very little warning, the bladder contracts even more, and they leak urine, which can be sometimes a lot more than just a little bit of a squirt. Stress incontinence that we talked about earlier, if you have a cough, a little bit of a push in the bladder, you get a little squirt. Overactive bladder, if it's severe enough, the bladder doesn't stop. It keeps contracting, and you may have a full void, and you can empty your bladder completely and get really wet sometimes. And the prevalence or the incidence of overactive bladder and incontinence also increases with age, as you would expect. So the more people that have overactive bladder as they get older, more of those people also have incontinence associated with the overactive bladder. To put it into perspective about how frequent overactive bladder is, these bars represent the millions of people that have these conditions. So bronchitis, asthma, heart disease, sinusitis, overactive bladder, and hypertension. Except for hypertension on this list, overactive bladder affects more people. Very prevalent. So why don't most people get treatment for the overactive bladder? On the patient side, people may think that it's normal, a normal part of aging, and may not tell their doctor about it and just put up with it. They may think it's not severe enough and they've found a way to cope with it, whether it's adjusting their lifestyle, using pads, knowing where all the bathrooms are, etc. They may simply think that it's too embarrassing to talk about and don't want to bring it up, even though it really is bothering them. Or they think that treatment is not going to help, and why bother telling anybody about it. On the doctor's side, and a lot of doctors are becoming more aware of it now that more medications are available, there's more advertising and more education. They don't know how to screen for it, they don't know how to ask the patients about it. And this applies more for primary care physicians, which are becoming more aware. So why should you care? Very small percentage of patients are actually receiving treatment. So the vast majority are never diagnosed or treated. 16% have received therapy in the past but may not have responded to it and may have dropped it. And only 7% of the people out there are actually receiving active treatment that they continue taking, that they find helpful. And how does this affect your quality of life? These are all the different ways that overactive bladder can affect you. Physically, it can affect your activities because you don't want to go outdoors with family or friends. You're worried about not being near a bathroom. At work, it may actually cause you to miss work. You may not want to do certain activities at work that limit your job and kind of bother your employer. It may even cost you your job. Somebody who's sexually active may worry about the effect of the sexual activity stimulating the overactive bladder, causing embarrassment, so they avoid sexual activity with their partner, and causes relationship problems. It can cause depression, loss of self-esteem, feeling like that they're a burden on society or their family. It limits your social interaction with family and friends. And it can be expensive because of cleaning up accidents, wearing adult diapers, all the expense and cost of the laundry, etc. So it is not just an inconvenience, it can have a significant impact on people individually and society in general. And what else can it do? It can lead to disabling conditions. If somebody gets up in the middle of the night with a sudden urgency and they're still half asleep and they slip and fall and break their hip, for example, that can lead to a serious problem. They can slip and hit their head. If somebody's constantly incontinent and they're wearing pads, that can cause skin irritation. It can cause urinary tract infections. And that can complicate their general health and lead to hospitalizations, which have their own complications. You want to be outside of a hospital if you can. And this basically just shows you somebody with a pinned hip that had a fracture. Studies have shown that about 19 to 42% of patients with overactive bladder sustain some sort of fall. Not always bad enough to cause a fracture, but some sort of fall, and many do actually cause fractures. Hip fracture is one of the most common causes of morbidity, illness, and mortality, death in older patients. The economic burden of overactive bladder. Basically, if you look at arthritis, overactive bladder, pneumonia, osteoporosis, and breast cancer, the cost in millions is quite high. Okay, so what are the behavioral things that you can do that are fairly easy before you go on to getting medical therapy? Keeping a bladder diary, we found, is very helpful for people. We think it's just the placebo effect or the fact that you're more aware of what you're drinking and how much you're avoiding. So what you do with the diary, my office, for example, has ones that we could just photocopy for you, or you could just make your own chart on a grid, and you write down the time of day, how much you drank, whether it's an 8-ounce glass of water or whatever can of Coke, and how much you avoided. And whenever you avoid, the volume, you estimate the volume that you avoided, and you also mark with a little X whether you had an incontinence episode or not. The more you do that, if you keep that for 2 or 3 days, a lot of people start becoming aware of what they're drinking. Maybe I'm drinking too much, maybe I'm drinking the wrong things. Something with caffeine, for example, irritates the bladder. Alcohol irritates the bladder and can make the problem worse. Keeping a voiding diary is helpful. Managing your fluids. Most people probably drink more than they need to. You never want to get dehydrated, especially in hot, dry weather if you're active outside. And water is good for you, but your body can't store water that it doesn't need. If you're already well hydrated and you drink another glass of water, it's just going to go through you and it's going to be as in the form of urine. And if your bladders are already hyper and your functional bladder capacity is only 200 milliliters and you're making 300 milliliters an hour, well, you're going to go to the bathroom a lot. There's no way around it. So cutting back on when you drink, especially at appropriate times. Before you go to bed, you don't want to drink tons of water because you're going to get up. Before you go on a long car ride, you don't want to drink tons of water or anything with caffeine in it. It's going to make you go. Using timed voiding. That means voiding on the clock. You set your clock basically, whether mentally or an alarm if you need to go, say, for example, every 2 hours. So if you notice from your diary that you have an urgency episode and leakage every 3 hours, well, go to the bathroom every 2.5 hours before your bladder gets too full, and you'll never have an accident. Pelvic floor exercises and biofeedback that we're going to talk about more later. Bladder training is a similar thing. Another simple way of bladder training yourself is if you get the urgency to go and you don't have the severe form where you're going to leak immediately, try to resist that urge. Because often the bladder will relax. If you give it a couple of seconds, a minute or two, it'll give up and that urge may pass. So the first time that you get the urge, hold it for an extra minute before you go to the bathroom. The next time, hold it for an extra 5 minutes, and so on, to the point where you may actually be able to prolong the period, and you may be able to use mind over matter type of control over your bladder and prolong the duration between voids. Education and reinforcement, that's what your doctor or therapist can help you with. Now, if all this fails, then the way to go after that is medications. Oh, let me just sort of go over what nocturia is. Nocturia means getting up at night to void, to pee. That could be caused because of an overactive bladder, but there are a lot of other causes for why people get up at night. Some people just don't sleep very well. Whether they have sleep apnea, they have depression, they just have sleep disturbances, they nap too much during the day. And they get up frequently, they don't sleep very soundly, and then when they're up, they decide they need to go to the bathroom. So it's the chicken and the egg thing. It wasn't really the bladder that got them up, but they will go to the bathroom just because they're up anyway. Not restricting fluids in the evening. If you drink too much, you're going to pee too much. Using diuretics. Some people use water pills because of leg swelling. Their doctors put them on diuretics. If you take your diuretic at night, well, you're going to generate all your fluids at night. So you should take the diuretic in the morning if possible. Get rid of all the excess water while you're awake. You're less likely to get up at night. Using compressive stockings. What happens in a lot of people is they have bad flow of blood and fluids in their legs because of bad veins and bad valves. So all the fluid in your body collects in your legs. Your legs swell up at night. And your body is not making a lot of urine because the kidneys are not seeing all that fluid. When you lie down at night and you're flat and your legs maybe are a little more elevated, all that water rushes back to your kidneys and your kidney starts to make urine. And all the urine that you didn't make during the daytime, you make at night. So using your diuretics during the daytime, using compression stockings to help the fluid return during the daytime, will make it less likely that you're going to get up at night. And of course, if you have sleep apnea, you see your doctor and they may put you on a CPAP machine or, to help you sleep a little bit more soundly. So to summarize, it is very prevalent. It affects about 33 million people. It can have a very significant negative impact on your quality of life as well as society in general, your ability to work, economically, etc. If you have urgency and urgent incontinence, it can increase the risk of hospitalization, depression, fractures, and infections. And only a very small percentage of people actually seek treatment when they really should go see their doctor a lot sooner. If all the conservative therapy doesn't work, there are medications called anticholinergic medications or antimuscarinic medications. You may have heard about them in magazines or in TV ads. Those include Detrol LA, Vesicare, Enablex, Toviaz. They're advertised very heavily. And what they do is they block the transmission of that signal from the nerve to the muscle, to the bladder muscle. And you don't, of course, not to the point where you do harm. What you're doing is you're trying to cut down that signal to the normal level. Overactive bladder is too hyper. It's overactive. The bladder contracts too much. If you sort of cut back that signal to the normal level, then the bladder capacity can increase. Your bladder can actually hold more urine to 2 or 3 hours rather than once an hour. And then you're not going to go as frequently and you're going to have fewer accidents. Those medications do have their potential side effects. So not everybody is a good candidate. They can cause dry mouth, they can cause constipation, they can cause dry eyes, blurred vision in some cases. Those are rare. The dry mouth is pretty common. The others are pretty rare. And your doctor will titrate you to the right dose and will try different medications to find the one that fits your general health and your condition. Thank you for listening.
Hi all, I'm Sabitha. I came here because Kathy just told me that this has been, pelvic floor dysfunction has been a major problem, and we all, including a younger to older generation, have always had problems with control, especially with urine and bowel and everything. So I just thought I'll give you guys a heads up of what Kegel exercises are, and then also teach you some of the techniques and ways of doing things and when and where and things like that, and to answer some of your questions. Has any of you tried doing Kegel exercises here any time at all before? So can you just tell me what is the basic thing?
I've never had that much success.
Okay, okay. And anybody else? No. So basically, the pelvic floor has one of the major muscle in the pelvic floor is the pubococcygeus. So what happens is you have the pubis in front of your pelvis, and then you have the coccyx in the back. So there are these muscle groups that go all the way from the front to the back to the coccyx, and there are 3 basic muscle groups. One is the pubococcygeus, the other one is the coccygeus, and the other one is the iliococcygeus. So the names are just based on where the muscle group starts, and then finally they all connect from the pubis all the way back to the coccyx. So that's basically what it is. And then so the pelvic floor exercises are called Kegel exercises basically because it was first tried by a physician, Dr. Kegel, for some of his patients because they had problems with prolapsed uterus and urinary frequency and things like that. So that's basically what it is. So the pelvic floor basically acts like a hammock, and it supports all the intra-abdominal organs and the pelvic organs, and to keep and just keeps them in place. So so how do you do these exercises? It consists of just basic 2 things, just squeezing and relaxing. And you just manipulate the squeezing and the relaxation time to actually get an effective strengthening for the pelvic floor muscles. So first, what you have to do is to first find the right muscle group to work on, and that's been a major problem for a lot of my patients that I've had, and to a lot of elderly population. So this is what it is. So what you would do is, if you have problems with holding urine, and that's because the muscles around the urethra are not strong enough, you would first find a way to actually work specifically on that muscle group. A lot of times we say I'm doing Kegel exercises, but we actually start using the abdominal muscles, the back muscles, the buttock muscles, and the thigh muscles. So when all these extra muscles start working, you're actually, the work that has to be done by the pelvic floor muscles is actually not done effectively. So that's basically what it is. So what you would do is actually finding the right muscle. So one of the ways for the urethra is to stop urine midstream. That's one of the basic exercises that I teach my population, my patients. How would you do that? You start off in the bathroom. So when you start peeing, you would actually try to stop it midstream and then hold it, say, for a couple of seconds. Because if the muscles are very weak, you would start off with just a count or 2 counts of holding in between and then releasing it slowly. And then again, hold it again for a couple of seconds and then release it until you're completely done emptying your bladder. So that's one of the basic ways. And then if you find that this pee is being stopped, then that's the right muscle. That's how you identify it. So if you feel that you're not getting an effective contraction, keep trying it every so often during the day. And sometimes we even recommend them doing at least 200 times a day. So to get the best, to identify the right muscle, basically. And then once you get a hang of the right muscle, then you would progress on to several sets of exercises done in different ways. So that's to begin with. And then basically the pelvic floor muscles are injured, especially during childbirth, and then post-op, especially during surgeries for hysterectomy and things like that. What you would do is these muscles, basically, let me tell you some of the benefits of these exercises. One thing, it basically helps strengthen the muscles of the pelvic floor. That's one. Number 2, the pelvic floor muscles also help improve the circulation in the pelvic floor region. And that, in turn, helps prevent hemorrhoids. And it helps improve hemorrhoids because hemorrhoids are basically caused by blood flow being restricted to the pelvic floor area. So the muscle contraction helps pump blood back and forth from the pelvic region. So that's one of the major advantages of doing pelvic floor muscle exercises. The other one is also, so say for example, if there is a pregnant person, then that again helps them do Kegel exercise. Very important. We teach them as a prenatal exercise because when you contract the muscle, what happens is it basically helps with improving muscle control, which later on helps postpartum for recovery of the person. So that's one of the things. And then identifying. So number one, I did talk about stopping the flow of urine and how you identify the pelvic floor muscle. And the next one is, how do I do the pelvic floor exercises? There are several different variations. One is you would do a basic Kegel to start off with. That would be just straight contraction and relaxation. So it would have to be a strong contraction, as strong as you can get, and just release it. So that's one of the basic ones. So start off with one tightening contraction and then just release it, wait for a second or 2, and then start again. So it'll be like quick, 1 second, 1 second, and then progress to 2-second contraction, 2-second relaxation. And continue on until you are able to do a 10-second contraction and then a 10-second relaxation. I would want you to actually space out the contraction and the relaxation. So even out the timing between the contraction and the relaxation, because you want the muscle to be able to get back the energy to be able to do it again. So that's basically what the relaxation is all about. And then going on to sustained Kegel. So once you are able to get a hang of the basic Kegel, move on to the sustained Kegel, which involves you contracting, holding, and then relaxing. So that's the second one. So instead of when you did the first one, it was a quick contract, relax, contract, relax. With the second one, where we call the sustained Kegel, it is going to be contract, hold, relax. All of them done in a slow manner. So that's the most important part. So say, for example, you contract 1, 2, and then you would hold 1, 2, and relax 1, 2. So space out and do it in a slow manner. And sustained contractions usually help fire muscle, increase number of muscle fibers that are firing, and that way it helps increasing the recruitment of the muscles to be able to get a good strengthening eventually. The next one is the elevator Kegels, which you might all have heard. It's the same thing as a sustained contraction, except for the fact that you're not going to slow hold, slow contract, slow hold, and slow relax. Instead, you're going to do a slow contraction to, say for example, 2 counts, and then you contract again 2 counts, contract again for 2 counts, and then hold it, and then relax a little bit for 2 counts, again relax a little bit more for 2 counts, and then relax completely. So there is a slight difference in the way you do it. It's all based on the number of seconds you contract, when you release it. So the elevator Kegel, it's called elevator Kegel because you can just imagine your pelvis to be an elevator, and what you would do is just think of the base of your pelvis or your urethra and around surrounding areas to be the basement of the first floor, and then imagine the top of the pelvis or close to the umbilicus as the top, or say the 6th floor. And then what you would do is actually start contracting for say 1, 2, 3, and then hold it. Think that you're going to the 1st floor, and then hold it right there, 1, 2, 3, and then contract it again, 1, 2, 3. Think that you're going to the 2nd or the 3rd floor, hold it again for a count of 3, and then contract it again until you get to the 6th floor or the 5th floor, whatever you imagine. And then once you get to a certain point where you can't contract it anymore and you've reached your max, then you would start releasing it slowly. Do never ever release a contraction quickly, because then you don't get the best benefit out of that muscle contraction. So when you release it, again, you're going to release it stepwise. So say from the 6th, think you're in the 6th floor already, then you're going to release it 1, 2, 3, and then you get say to the 5th or the 4th floor. Again, hold it there, 1, 2, 3, and again release it until you get to the 2nd or the 1st floor, and then hold it again, 1, 2, 3, and release it again until you get to the basement. So that's basically imagination and you contracting the muscles to get the effective strengthening out of it. So now, when should I do the Kegel exercises? To start off, you're going to have to do it, like I said, in the bathroom while you're peeing. And eventually, once you get a hang of the right muscle, then you can do it anywhere, while you're driving a car, when you're just standing, talking to somebody, watching TV, anytime, anywhere. It's an easy way to do it, and nobody can see what you're doing. So that's the best part of it.
Thank you very much.
Thank you. Sure. Mm-hmm.